Hi, I'm Marthel Neville. Time now for Sunday House Call.
And I'm Greg Jarrett. Welcome to everybody. Joining us, Dr. David Samadi, who is chairman and professor of urology at Lenox Hill Hospital and chief of robotic surgery.
Also, Dr. Mark Siegel, professor of medicine at the NYU's Langone Medical Center, also author of False Alarm, The Truth About the Epidemic of Fear, joining us live via Skype this Sunday. And good to see both of you, docs, and we'll get right to it. Thank you, Dr. Mark, and as we mark 1 week since the terror attack at an Orlando nightclub, Pulse, that left 49 dead and dozens injured, the massacre will no doubt leave lifelong scars on those directly involved, but it will also be felt in less visible ways by many people who've been watching the tragedy and its fallout from afar. So how do we as Americans cope with this going forward? And Dr. Samadi, I understand that there are stages of emotions.
Well, the biggest way that the terrorist is going to get us, it's not their bullets and it's not their guns. It's really the emotional and psychological scar that is going to be left behind. And we're talking about fear in this segment. So fear actually is a self-defense. It's a great thing that we have in order to defend ourselves against something called trauma or tragedy or plane crash or terrorists or whatever it is. That's the first stage. And that's your flight and flee or flight mechanism. Your adrenals, your brain starts to pump all that adrenals, noradrenals, and your heart rate will go up, etc. Now, the phases are trauma, fear, then you have anger, you have guilt. And the sooner people get through this, and the sooner we face our fear and deal with it and get through it, the better outcome we have. 15% of patients, unfortunately, go through this and get stuck in certain phases, either fear or anger, etc. And then we have to deal with post-traumatic stress disorder, when it becomes a longer, chronic, over a month kind of issues. So what's interesting is that in your brain, you have a center called amygdala and hippocampus. And that fear mechanism can actually become so hyperactive and so sensitized that can really become a big problematic. So dealing with this, accepting the fear, and we'll talk about some of the treatments, are absolutely the way to go to deal with this.
And I want to bring Dr. Mark in, because Dr. Samadi just said something that it's possible for us to get stuck in one of those phases. Dr. Mark, do you have anything to add to that, or you want to bring something else to the table?
Well, he's absolutely right. I wrote about this in False Alarm. There's something called a cycle of worry, where you start to get attached voyeuristically to the news, and you can't stop watching these images, maybe out of compassion, Arthel. But then after a while, your heart rate goes up, you can't sleep, you worry, you get an outpouring of adrenaline, noradrenaline, cortisol. And a researcher down at NYU named Elizabeth Phelps actually put people in front of a video camera, showed them the same images that people were experiencing when they went through terror, and they found that some of the same physiological responses occur. Now, what is a treatment for this? One treatment is role modeling. Choose people that have courage through these things. Laughter goes through that same fear center in the brain, known as the amygdala. Laughter, courage go through those same centers. Choose a fear guide. Watch out what your children are seeing. You know, they're seeing you be afraid, then they're going to be afraid. Then they'll be afraid for the rest of their lives. Exercise. Sleep right. Find out ways to break the stress. Come down here to the Cayman Islands. Take a vacation if you need to, but disengage. Listen to the news. Everyone wants to learn from this. But as David said, the tool of terrorists is fear. It is not guns, so we cannot give in to that.
Dr. Samadi, what is the effect of fear and anxiety on an individual's overall health?
Well, that's a very good question, because the same adrenal gland can actually pump those hormones that we talked about, can really increase your blood pressure, it can increase your heart rate, it can lead to stroke and heart disease and obesity and diabetes. So it's important to really understand that you have a problem. First, you have to face the fear, understand you have it, surround yourself with people that you trust, and make sure you're not alone. So many times I've seen people that have come from the war, they're my patients, now they come with prostate problems, and I have gotten these letters saying, like, this is the last time you're going to hear from me because they have the issue. So getting help and asking for help is absolutely, and you know, today, Arthur, we have so...
You mentioned, I'm sorry, because it's really striking me, you mentioned patients who are veterans. What about, and of course we always are very much in favor of treating our veterans properly, but folks who are watching who are not vets, they're dealing with regular regular stress? How does it affect?
Well, you're going to see the effect of fear is actually can affect your thoughts. So you're going to have the flashbacks of the event at the club. You understand that, how come I couldn't do something different? So that guilt will come out. There are emotions, depression, anxiety, and all the fear that we have. Then it becomes a physical part, the withdrawal, not being, avoid other people, getting to drugs and alcohol, and finally is the physical, which is a lack of sleep, lack of appetite. And the sooner they break the cycle, not only you break the health hazard that comes with it, but you can get back to your norm, and that's really the key. And today, we have so many treatments, Greg. We have antidepressants, we have desensitization, which is cognitive behavioral therapies, biofeedbacks, and that's really important for people to know.
Is it possible, Dr. Siegel, and we've only got about 30 seconds left, so I'll make it quick, is it possible that people could be suffering the symptoms of all of this without even recognizing it?
There's no question about that, and that is happening right now. And we're going to talk later in the show about heart disease, the #1 killer of men and women, strokes, depression. These are cancer. These are huge problems, and if you carry the stress from this, from worrying too much, from worrying about terrorism too much, not only are you going to have sleepless nights, but the long-term health risks worry me. I've seen it. It's been studied in studies out of Israel and other places where people exposed to terror or even images of terror have a higher risk of heart disease, high blood pressure, and stroke.